The ABCs of ABGs. Understanding arterial blood gases. The objectives of this course are to identify why an ABG interpretation is an important skill for nurses, to differentiate between acids and bases, to identify two of the body's buffering systems, and to understand the steps of a basic ABG report, and to adequately identify and interpret acid-base problems. ABG analysis is a diagnostic tool that reflects the patient's oxygenation, ventilation, and acid-base balance. Knowledge about interpreting ABGs is consequently essential for all nurses, but especially those who work in environments like the emergency department and critical care units. It is essential for nurses to be able to critically analyze each component of the ABG report to prevent errors in interpretation and treatment. Acids versus bases. An acid is any substance that can donate a hydrogen ion, whereas a base is any substance that can accept a hydrogen ion. pH is a measure of the acidity or alkalinity of a substance. The pH scale is based on a 1 through 14 numbering system and is used to reflect the degree of acid and base in a solution. In theory, 7 represents neutrality, so anything below 7 is acidic, anything above 7 is a basic. Acid-base status is a reflection of the pH in the body, specifically in the extracellular fluid. In the clinical practice, we refer to a normal pH value of 7.35 to 7.45. So anything below 7.35 is considered acidic. Anything above 7.45 is considered an alkaline. Any variation in pH can cause metabolic functions to slow, and in the presence of extreme changes, function will stop altogether. The body has 4 buffering systems that work together to maintain a normal pH balance of 7.35 to 7.45. It's the chemical buffers, the respiratory system, chemoreceptors, and the renal system. The first buffer we're going to talk about are chemical buffers. They're substances that combine with acids or bases to maintain a normal pH. There are 4 that we're going to discuss. 4 blood buffers: hemoglobin, bicarb, phosphate, and protein. Hemoglobin is a molecule with a strong affinity to combine with and transport oxygen to the tissues. The role of hemoglobin in gas exchange is best explained when discussing oxygenation. Oxygenation is the addition of oxygen in the human body. The greatest amount of O2 is carried in chemical combination with hemoglobin inside red blood cells, which gives us the oxygen hemoglobin saturation. Bicarb is the second chemical buffer. It's an alkaline component that reflects renal function. The renal system is the body's primary buffering system. A normal bicarb level is 22 to 26 milliequivalents per liter. The renal system adjusts slowly in response to changes in respiratory needs. The third chemical buffer is phosphate. It acts in the same way as bicarb, which means it combines with substances to stabilize the body's pH, but is not as effective as bicarb for blood plasma, while it is very effective buffer in the urine and intracellular fluids. Protein is the last chemical buffer. It's the most plentiful buffer in the body, which is why patients with anemia or low plasma protein levels suffer from wide swings in pH when they are sick. The respiratory system is the second buffering system. It is responsible for ventilation, which means when oxygen is inhaled, oxygen and CO2 are exchanged in the lungs. Therefore, a CO2 is removed from the body during exhalation. CO2 has an inverse relationship to pH, which means if the CO2 rises, there will be a decrease in pH, which means CO2 is an acid, which is controlled by the lungs. A normal CO2 level is 35 to 45 millimeters per mercury. So if CO2 goes up, then pH will go down, like in hypoventilation. The patient isn't breathing the acid off, so it's building up. Whereas CO2 goes down, the pH will increase, as in hyperventilation, the patient is breathing off too much acid. CO2 adjusts quickly in response to metabolic changes. O2 is presented to the pulmonary system as partial pressure gas. Hypoxemia is below normal values of partial pressure gas. A normal PaO2 is 80 to 100 millimeters per mercury. Mild hypoxemia is 60 to 80. Moderate hypoxemia is 40 to 60. And severe is anything below 40. If the patient is hyperventilating, what type of pH